Dr. Bellows, welcome back to the Pet Buzz.
Thank you.
Hey, the last time we spoke, you mentioned retirement. Have you retired yet?
No, I just can't stop.
I know. I'm with you.
It's not finding time, it's finding meaning. So if I retire, I'm afraid I won't find meaning.
I think a lot of people want to understand why it's important to brush pets' teeth.
Well, just like we brush our own teeth several times a day, it removes plaque. And plaque is bacteria and food substances that attach to the tooth and attaches right by the gum line. And eventually the happy bacteria underneath the gums, because of lack of oxygen, turn to bad bacteria if it's not removed mechanically. So it has to be removed by either wiping or better brushing. But unfortunately, most people can't figure out the whole toothbrush thing. So, in my area, I recommend just the wiping with dental wipes at least twice a day to remove the plaque so it doesn't block the good bacteria from doing its job.
Tell me if this statistic is true. I mean, by the time cats are 4 and dogs are 3, aren't they already suffering from dental health problems?
80% of dogs, by the time they're actually 3 years old, and cats by 4, have significant painful dental problems that need treatment.
Pet owners really know that it's really important that the teeth of the mouth get cleaned, but they just don't do it because it's difficult. So can you give a few tips?
It's so important that plaque is removed daily, if not twice daily, from dogs and cats' teeth. And in dogs, we highly recommend toothbrushing. Use a soft bristle toothbrush. Let the pet get used to the toothpaste first. You don't have to do the entire mouth on the first day. Do 1 or 2 teeth and do more and more as time goes on. And start, if possible, when the puppy or kitten is very, very young. If you just decide after a professional teeth cleaning at the veterinarian that, okay, it's time to brush your teeth, then you have to do it when they're older, but try to make it fun. In our family, we use actually dental wipes that we wipe the teeth every day, and it's just the outside surface of the upper teeth you concentrate on. But after I do the wiping, my dog gets a treat, and the dog actually gets 2 treats.
Two treats, upper and lower.
Riley knows that she's going to get 2 treats, and she comes back for the second one, as long as she lets me wipe her teeth.
Talk to us about why dental cleanings are a necessity. But first, tell us who can best perform the dental cleaning, because there's so many groomers who want to clean teeth in these special places that you go.
It really needs to be done under a general anesthetic by a veterinarian. And the veterinarians are trained in anesthesia, and the AAHA, American Animal Hospital Association, and the AVMA, the American Veterinary Medical Association, mandates that animals receiving dental care are anesthetized and under general anesthesia. A tube is placed underneath their in the mouth down the windpipe to keep the oxygen and to keep the anesthesia. And clients sometimes are fearful or anxiety having to do with anesthesia, but anesthesia has become incredibly safe thanks to evaluating the pet first and then tailoring the different type of anesthetic, and mostly the monitoring. So we know if there's going to be a problem generally before the problem occurs. So anesthesia has become incredibly safe, and that makes the dental procedure, which essentially is every tooth is scaled, dental x-rays are performed to see what's going on underneath the gum line, and then teeth are polished. And on top of that, we add a sealant, which decreases plaque accumulation underneath the gum lines. Daily brushing still should be done, but still at least once a year, the teeth should be evaluated under a general anesthetic, each tooth one by one. Cats have 30 teeth, dogs have 42 teeth. People have 36. So dogs have a lot more than people do.
I think one of the things people are always concerned, right, Dr. Fleck? They want to know why their pet needs to have blood work.
Well, that adds to the safety level because unfortunately, when clients are motivated to get their teeth cleaned when they smell bad breath, because most people want to hug their animal, they want to speak to them close, they want to kiss them. And if they smell doggy breath or cat breath, they think something may not be normal here. And they open up the mouth and they see there's a lot of plaque and tartar. So unfortunately, sometimes that plaque and tartar causes bacteria to go to bad places like the kidneys. And in my own dog, my 4-year-old dog was in kidney failure, not because of the teeth, but because it had a congenital problem. And if we didn't know that beforehand, before anesthetic, it could have been a big problem. So every animal gets preoperative testing based on what the veterinarian feels comfortable with. Many of them get blood work, many of them get EKGs, blood pressure, some chest x-rays. A lot depends on what they have. And because of the paradigm shift is now so pro getting the teeth cleaned at least once a year, many of your larger animal hospitals, the big corporations, the Banfield, VCA, NVA, they now have incorporated professional teeth cleaning under anesthesia with dental x-rays into their annual or their monthly fee. So they charge a client a monthly fee that covers exams, covers discounts, covers vaccines, and teeth cleanings. So it just makes it so much easier and better for the pet.
Depending upon what happens during the dental procedure, speak about the aftercare.
Well, during the dental procedure, the veterinarian will contact the owner because if there's halitosis, if there's bad odor, that means there's pockets. That means breakfast or the dinner the night before went into a pocket, or dinner 6 months ago went into the same pocket, and the food is still getting putrefied. That's where the odor comes from. So the care of dentistry is to eliminate the pockets. And oftentimes, because of that, you have to eliminate some teeth. So there'll be some sutures that self-dissolve. And generally, there's soft food that is recommended for at least 3 or 4 days after the procedure if teeth are extracted. And then the dog and cats are really good to go. They heal. One of the beautiful parts about working in the mouth is there's so much blood supply that they heal really quickly.
How much does food make a difference? We always talk about, making sure your pet has dry, crunchy food. It also helps clean the teeth. Or soft food, which tends to stick to the teeth more.
That's a myth.
Okay.
The wet food, they did research that compared wet food to dry food diets, and they were identical. Where you get into trouble is the semi-moist foods in dogs and cats. Those are the ones that are in little plastic containers that are yummy for the animals, but they stick to the tooth itself because it's semi-moist. So you want to try to avoid them if you can. On the other side, the dental diets, Eukanuba and Hill's diets and Royal Canin diets, all have, some of them have chemicals in it called sodium hexametaphosphate that decrease the plaque production on the teeth. And that really helps to control plaque because some of the diets, like the Hill's diet, just works mechanically. So where the TD diets work best is when they crunch on the product, it squeegees off the plaque. But other diets, like the Eukanuba diets, have mechanical action, which squeegees, plus chemical action. So it helps to affect teeth that don't even touch.
Sure. Now, what about bones and toys? Because so many people are buying dental toys and dental bones. And
I am so glad you brought that up. See, the bones, a product needs to be digestible, be soluble so it doesn't cause obstruction, and bend. So your nylon chews can break teeth. Antlers, very common. People give their pets antlers. They love to chew on them, and they break the back teeth. Necessitate, and the nerve gets exposed, and then they bring it in, and we have to do a root canal and put a crown on the tooth, which is, if the people would not give their pets antlers that would prevent it. Real bones aren't good for animals because, again, they chew on them and they don't know any better and they break their teeth. So avoid those. If you're going to give a product, there's a Veterinary Oral Health Council, vohc.org, which lists over 40 dog products and 15 cat products that tend to decrease the accumulation of plaque and or tartar, and most importantly, are safe. vohc.org.
Dr. Bellows, tremendous information. I'm sure our pet parent listeners enjoyed this immensely and learned a great deal and know how important it is for the health of the oral health for their pet. So thank you so much for being here. You want to give us your website?
My website is allpetsdental.com.
Thanks for viewing our content on Pet Buzz Plus.